He was talented, energetic, passionate.
When Don Flattery talks about his son Kevin, pride overshadows the pain.
He participated actively with his friends and was well accepted and well adjusted.
Kevin grew up in Alexandria, attended Gonzaga College High School in D.C., and graduated from UVA before moving to Los Angeles to pursue a promising career in film production. But while being treated for anxiety and depression, Kevin began self-medicating with opioids like OxyContin. The Flatterys brought him home for extensive care and rehab, but the prescription drug addiction continued and evolved, eventually leading to a suspected heroin overdose on Labor Day weekend.
This affliction is not one that is a choice. This is not a character flaw. This is a public health issue, and it should be treated as a disease.
What happened to Kevin is tragically happening more and more across the country and in the D.C. region. Kids from the suburbs get a hold of prescription drugs from medicine cabinets or friends, start using, then when the pills run out, heroin, cheap and easy to get, fills the void.
The fear of it, for whatever reason, is gone.
A study published last month by the Centers for Disease Control found a 74% increase in heroin use between 2009 and 2012, with 75% of users saying they first abused prescription opioids.
We've made it really difficult to go after and get the pills, but unfortunately, the unintended consequences of, well, what's come back? Heroin.
There is this poison coming into our communities.
Special Agent Jay Perry with the Virginia State Police coordinates a task force battling the rampant growth of heroin in small-town Northwest Virginia.
When people think of heroin, a heroin user, what do they think of? A junkie, right? That's not what we're dealing with. These folks are average, everyday folks, people that have jobs, people that have families, people that have children.
I would like other parents to know that this particular epidemic can strike them. If it could strike my son, it could affect their daughter.
It's a very warm, comforting effect.
Heroin was like nothing John Miller had experienced before.
You just feel like everything in the world is okay. No matter, the bombs could be going off left and right, and you'd be okay.
Despite growing up in an upper middle class home in Great Falls and attending UVA, Miller was no stranger to hard drugs. In his 20s, he developed a taste for psychedelics, then cocaine. Around age 30, he moved on to heroin, and it took hold with a vengeance.
Sometimes it wasn't even because I wanted to get high anymore. I just didn't want to feel miserable. Nausea, vomiting, diarrhea. I told myself, I said, I'm in too deep. I need help.
But so many addicts don't get help, and the results are tragic. A study published last month by the Centers for Disease Control found that heroin overdose deaths in 28 states, including Virginia, doubled between 2010 and 2012.
It just takes that one time to get hooked, or that one time to overdose, where people lose everything. They lose their home, they lose their job. It's a horrific drug that we're battling.
Virginia State Police Special Agent Tom Murphy coordinates the Blue Ridge Narcotics and Gang Task Force, covering areas like Fauquier and Culpeper counties. Murphy says the heroin is coming in from Afghanistan, then being funneled through major U.S. cities, including Baltimore, a regional hub. It has trickled down to small-town Virginia in a big way, where people are shooting, snorting, or smoking a brand of heroin that is nothing like it was 20 to 30 years ago.
Heroin was typically 5 to 10% pure. Today we see heroin that's as much as 40 to 65% pure. The problem with that, obviously, is the more pure or potent the drug is, the more likely you are to overdose.
I think it's going to get worse before it gets better.
Debbie Taylor is vice president of Phoenix House, an addiction treatment center in Arlington. And though it takes time and a lot of effort, she says addicts can recover.
People get better. Treatment works.
I don't want to live that way anymore.
John Miller is on his road to recovery, 6 months clean and counting.
Life is a gift, and I did not treat it like that for many years.
Jeff Goldberg, ABC 7 News.